appreciate you giving me this opportunity to share about our wonderful organization and share some of the collaborations that we have together and certainly how we serve the justice involved community. So I am going to try to hopefully show a video as well, and the sound will come, but let's see. So can you all see that? The right screen, hopefully. So for myself, born and raised Hilo, good Catholic boy, went to St. Joe's School. I don't know what happened after that, but I really grew up in the halls of HPD. My dad was a police officer and a detective, but he married into a family that had a lot of, you know, like justice involvement. So it was always very interesting to live on the two sides of that balancing bar, on the criminal side, but then have cousins, you know, in and out of the jails and prisons. And then my blood brother, he suffered from mental behavioral health conditions such as paranoid schizophrenia. So he was in and out of the system. So it's really a passion of mine and what I do. So if I wasn't working here, I'd just go across the hall and ask Les for a job. But we serve all of the island. We have two offices, one in Hilo, one in Kona, but our admin office is right by you folks. And so we're really about providing a safe space to underserved communities, especially those living with HIV, but also those with similar health disparities. We started 35 years ago, and this is when AIDS first came out, and AIDS just sort of ravaged different communities that people didn't want to talk about. So especially the LGBTQ community, substance using communities, those that injected drugs. And it really wasn't until Ryan White came along that had HIV. He was a kid about 13 years old, and they ended up like kicking him out of school, burning his house, like all of those things that it finally got national attention that, you know, if you ignore things in different communities, it's just going to end up spreading in other ones. And so that's where we started. We started as a volunteer organization, taking care of people who were going to die because there was no cure for this at that time. So since then, we've really expanded. You can live a long, healthy life with HIV as long as you get medication and equal access to healthcare, which we know is not always possible, especially on our island. But we serve all races and ethnicities. We have a huge list of like risk groups that we serve, but we're really based in harm reduction, being non-judgmental, being strength-based. Our staff is really composed almost completely of Native Hawaiian, Asian Pacific Islanders, and people of color. And we're the only neighbor island HIV and gender affirming care clinic in the neighbor islands. So I wanted to share this piece because when I came back from Oahu to move back home, you know, the place was called Hawaii Health and, no, it was called Hawaii Island HIV AIDS Foundation. And so there was a lot of stigma attached to the agency because we have expanded into the different things that we did. So we decided to look for a different name. I didn't want to do Hawaii Island Health or Big Island Health because we would be confusing it with other folks. And so we asked a cultural practitioner, like, what is a big island name that you cannot find anywhere else in the state? And so he gave us a list of 6, and Kumukahi was really the one that stood out for us. And so what we did was we went to Kumukahi Point. We went like 3 a.m. We met. We're gonna do welcoming of the sun. We're gonna ask Kumukahi, you know, to be able to take that name, and we left our pu'olu. You'll see in the video, our ho'okupu, that was the symbol of high half of what we were called. And so this is sort of our story me making people hike out at 2 in the morning with a television crew and everything. But it gives you a good sense of who we are and what we do.
In the beginning, everyone was scared. People felt alone. People were sick with a virus that no one understood.
It was during this time a few Hawaii Island residents banded together to help their friends and ohana, losing the battle with AIDS to have a death with dignity and aloha.
This is how we started 35 years ago.
We have grown from a small support group of folks providing end-of-life care to an island-wide agency with nearly 30 staff and volunteers to help educate our community, provide life-saving services for some of our most vulnerable people across our island, our state, and the Pacific.
We heard from our clients and our community members that the words HIV
Oh, sorry.
and decided to make a change to make it easier for our community to come to us to get the care that they need.
We also realized that our communities needed to know that we are much more than HIV. We've used what we've learned from this epidemic and applied it to other health disparities that affect our families here in Hawaii.
Kumukahi is the perfect place name for us because it uniquely identifies us as being from Hawai'i Island. Kumukahi is the easternmost part of Hawai'i Island, where the sun rises and where the sun rays first touch the Hawaiian universe. Kumukahi also means origins or beginnings, which reminds us of who we are, where we've come from, and what our mission is. We always remain mindful of the beginning of the AIDS epidemic and what it looked like, and of our own history in order to move forward.
We chose Kumukahi Health and Wellness to emphasize the holistic nature of our services. We serve as a safe place for Hawaii's most vulnerable populations living in the most rural and remote areas of our state.
We use the representation of the wa'a to symbolize our individual roles, which working together moves us into the future of the health services for Hawai'i Island.
We still serve those living with HIV, which is why we chose to keep the red ribbon in our logo. But we also want anyone and everyone to feel comfortable coming through our doors.
We will continue to answer the call of our people. We will continue to lead with the knowledge of our ancestors, coupled with the latest in medical breakthroughs and scientifically accurate information. We will continue to be the voice and the safety net for those who tend to get lost in our systems, our not so neatly defined boxes. We are the future of health and wellness. We are Kumukahi Health and Wellness.
And so that gives you a sense of, you know, how we changed. And when we did that, like the first thing we heard from our clients was, thank you so much. I felt so stigmatized. Like, you know, who wants to put in an Uber? I'm going to the AIDS Foundation. And we do like, you know, medical care insurance. Like people are asking like, why am I going to the HIV Foundation? So it was a big turning point for us. And in fact, we just celebrated our 3-year anniversary of Kumukahi Health and Wellness Day with the mayor. And then we went to our Kona side and did our opening as well. We're really based on 4 pillars of departments of what we do. So we have our HIV client services, we have our prevention, outreach, and engagement, then we have a clinic, and then we have insurance navigation. So the first one is our sexual health clinic. It's called Aiaola. I is sex, Ola is healthy, so healthy sexual relationships. So we do HIV treatment, we do gender affirming care, we do vaccinations, we do drug use education for those using drugs or injecting substances. You know, we have a lot of folks, you know, people mostly assume, you know, people that inject are, you know, homeless out in the parks, but we have, you know, those that are in the gyms and they're doing steroids, and steroids are illegal. And so they're getting it off the internet and they're sharing needles. And so whenever, you know, we put out our messages, we try and put it out at the gyms, we put it out at the university, you know, people are injecting different things or experimenting with drugs. Everybody's experimenting with everything nowadays. It's kind of crazy. experimenting with gender, experimenting with substances, experimenting, with life. It is a really different time. So we're trying to be there for people to be a non-judgmental place where you can get accurate information about the things that you're doing without judgment. Yeah. And so we have our medical provider, Naomi, we have our nurse, BJ, and then we have Dr. Knox, who is overseeing that. And then we have our client services, our HIV client services. Every December 1st is World AIDS Day. And so we hold an event to commemorate those that passed. Each candle is somebody that passed from our clientele of HIV during the past year. This is an amazing team that does it. This is the van or our SUV that we're able to get to do like North Kohala runs, go down into Ocean View, helping the people where they cannot have easy access to Hilo and Kona office. Then our other group is called Prevention, Outreach, and Engagement. I call it POE. And POE, does anyone know what POE means? The people. So clever, yeah? I made this up. So POE is the people, prevention. So we have our syringe exchange program. We do naloxone, fentanyl test strips. I think it was really amazing that we heard at the fentanyl summit, somebody that had successfully gone through treatment, but during the worst times of his life, he would not access any services at all except for syringe exchange. So he would come in, we would do the 1-for-1 exchange, and we give him Narcan. And that Narcan that he got, he actually was able to save 2 of his girlfriend's lives. So a lot of good work that this group does. Nightclub, park outreach, this is the fun group. They get to do all the fun stuff, especially our MMA community. We do the blood work for the MMA community because, after you win a fight, you're super popular after. Our tattoo community, making sure that after you get a tattoo or folks that are doing tattoos are tested and educated. And then we have our caravan services where we take all 4 departments and go around the island with this. And so that's our team there. And then lastly, we have our Kokua MedQuest program. And so this is all about equal access to healthcare and getting out into the community. And so we outreach to, KOFA community, the farm workers, justice involved, LGBTQ, all of those high-risk populations that normally don't come in for services. And so we do a Celebrate Micronesia health fair that we take around the island that has been really, really popular to get health insurance sign up for our KOFA community. And we've gone statewide, so now we have partners in all of the islands. And it's really, like I said, about signing up people that traditionally don't come in for healthcare services. A lot of people are like, is HIV still relevant? Well, during the COVID, we saw a huge rise in STDs. So I don't know, people were supposed to be like isolating and not doing anything. And then we get the call like, oh, Tui, I get like the itch, the burn, the drip, all that stuff. We're like, okay, come in. So, we stayed in, we kept our clinic open. But what happens is when STD rates go up, we start to see HIV rates go up because STDs create those sores and entry points for HIV to infect other people. And then sure enough, in 2021, we saw the most HIV our island has ever seen, 17 cases. Some was in a pregnant mother, some in transgender, some with justice involved. So it was a really, really scary time. And so from that, we created our PrEP Pono campaign. And so we wanted people to know about PrEP. And so PrEP is a pill that you take, and it's like 100%, almost 99%, that you're not going to get HIV if you go on this medication. And so people didn't know about that here. Especially I would go to doctors' offices and tell them about PrEP, and they're like, oh no, that's like, you're condoning like sex, you're condoning this, real judgmental shit that people shouldn't be like judged upon, something that saves a life. So we decided to come up with Prep Pono. So Pono means, you know, like to do the right thing. So the P we created was peace of mind. So it gives you peace of mind. Wait, let me go back. The O is one pill. The N, we was hitting our heads for days trying to figure out what the N was. And then we went on the CDC website and we're like, oh, 99% effective. Okay, perfect. And then the last one is once a day. And so, you know, I believe in using local faces, local places. I'm so lucky I got friends that were willing to be on this video. So it really tries to address like a cross section of our community. And we took it to a national conference and took second place for our PrEP campaign. So I want to share that with you really quick.
I prep Pono because it gives me peace of mind.
I prep Pono because it's once a day.
I prep Pono because it's 99% effective at preventing HIV.
I prep Pono because one pill makes a difference.
I prep Pono.
I prep Pono.
I prep Pono.
We prep Pono. To get started on PrEP or for more information, go to kumukaihealth.org.
So that's a campaign we're really proud of. And even more so is that the rates of HIV went down and people were coming in for a test and getting on PrEP. Unfortunately, some of them, it was too late. They came in to be on PrEP, but they found out they had HIV already. And so at least they're in a place where they can get services as soon as possible. So I just want to talk about a little where we kind of like cross-pollinate with one another. So, you know, with our Justice Involved folks, family and friends, there's definitely much higher rates of HIV, hepatitis C, and STI. So pre-COVID, we were able to go into the jails and prison. We learned tons of information about what folks are doing out there in the community. We get HCCC medical referrals to us. We give out free condoms. And we go to BISAC and I believe Bridge House, where we offer free testing after presentations as well. So there's also a very high rate of substance use, especially injection drug use. So we do offer a one-for-one exchange for clean needles, which I would say would keep needles outside of the parks, but it doesn't because the county has stopped us from going into the parks. And now all of these needles are like, they're finding, the Parks and Rec people are finding it in the bathrooms there ever since they stopped it from happening. But we're working on that. So Narcan, we do, and fentanyl test strips. So there's a lot of fentanyl in a lot of drugs that's out there. And so we hand out test strips where people can post, where they can test their drug of choice or whatever they're using to see if there is fentanyl in there. And I can't see the chat, so just feel free to open your mic. Only see the notification. There's a lack of access for healthcare services, especially for those who have been justice involved. So we do have our sexual health clinic, and we do hepatitis C treatment. So there's a lot of folks that who have injected. It's not enough to change the needle. All the works that they shoot up with, or the can have Hep C or Hep B on them for like a week or longer. Also, those that snort, they can get it from blood from the straw they're passing around, or from those that, you know, do meth. The pipe burns your lip, and then the other person shares the pipe. So there's also higher rates that are uninsured and underinsured, and this group has been wonderful in trying to get that worked out for those that are in jail or prison. And so we have that MedQuest navigation service where we're also trying to get into the jails to get people signed up before they leave. And, you know, there's a lack of sensitivity just in general for sexual minorities and gender diverse people. In the youth survey that was put out, Hawaii Island has the most diverse, the most LGBTQ rates of school kids in the state. And so, you know, one of the things we do is we do presentations, we do trainings for Hilo Medical, for other organizations. One of the things that people really get caught up on is pronouns. Pronouns, you know, people are like, well, what if you identify as a cat or I identify as that? You know, really, I use it as a tool for somebody that's coming in for service and I'm not sure what gender they are, right? I'm not sure if they're boy, girl, what. So what I do, I just say, aloha, my name's Tui, I go by he, him pronouns. What pronouns do you go by? And so when you do that, then it kind of acknowledges, you know, like there is a difference in gender, but then you also get to find out like just how to address them in general rather than dancing around the subject. So don't get too caught up in that whole national, like, you know, I identify as a chair. That's not what that's about. So advocacy on a statewide level, and then I'm super, super happy, like Les's vision for a non-gendered home. Like that's something that I want to support somehow. And, you know, I've seen the wonderful work that Going Home Hawaii has done. And I'm very, very just proud to be a collaborative partner with you folks. We just need money, man. We need more money. And so we're able to redesign our space in Hilo, and this has made it much more welcoming and inviting, and it shows the professional services that you're going to receive from our staff as well. So the staff, even staff morale went up with that. And so we're doing that in the Kona office as well. We're adding 2 more clinic rooms, like a wellness room. We have a private food pantry. And then, you know, space for our clinic and MedQuest staff, because right now they're on the conference room table, like talking to patients and clients and stuff. So it's not ideal. But anyhow, that is really my song and dance about Kumukahi Health and Wellness. And I couldn't see the chat until now. So I really appreciate, the prep and the services that we do. It's a important service that we serve because it's a specialized community that not everybody is able to reach out to or intercept. You know, we have those points of intercept, right? With where along the chain can we help people avoid jail? And so we are part of that. And hopefully during this talk, you've seen some pieces of where we fit in, and we definitely want to work with all of you and help any of you folks achieve that as well. So thank you very much.